Okay, so the urinary system, chapter 18, the job of the urinary system's primary job is to relieve the body of metabolic waste. So throughout the body, cellular activity, muscle metabolism, I mean, everything creates wastes. And, so a byproduct of cellular metabolism are these waste products, and they will be in the bloodstream. Now, there is an appropriate level of wastes, like I'm going to talk about a few of these things. It's just when, we want to maintain homeostasis, we want to maintain waste. So they have to be eliminated. And if they accumulate, they will cause various amounts of side effects and clinical signs that I kind of talk about. But they're of no further use. They can't be recycled. They can't be reused. And we have to get rid of them. So for example, carbon dioxide. Now, normally the majority of carbon dioxide is exhaled. Some is in the blood and some will be excreted in the urine. And also water excess body water has to be eliminated. And that's what makes urine, obviously, is part of it as body water. So maintenance of body water is going to be key within the urinary system. It can balance, because you don't want too much, you don't want too little. Nitrogenous waste, primarily urea. So when we talk about urea, that is a waste product. And something I want you to know for the test, I'm going to type it here in the chat, is, BUN is blood urea nitrogen. Okay. Okay. You don't need to know this number, but I do want you to know what BUN stands for. It's called blood urea nitrogen, and it's the level of urea and nitrogen within the bloodstream. Those are waste products. The body wants to get rid of nitrogen, and the body wants to get rid of urea. Now, when we do a blood chem panel, you guys will talk about in lab 3, we measure BUN, and appropriate levels would be somewhere 5 to 25 milligrams per deciliter. As long as your animal has a BUN in that level, the body is getting rid of urea nitrogen. Again, there's always it's never going to be zero. There's always some urea nitrogen in the blood. It's just, that's an acceptable level. To give you an idea, renal failure patients I've seen cats that have a BUN greater than 130. I had a cat, we had to keep diluting the serum because we could not get, it was so high. I did like a double dilution, and which would mean it was upwards of 300. And that cat was basically, so they can have more nitrogen. It's normally when we do a UA, we want that to be negative, but a lot of times it's based on their diet because of their primarily carnivore diet. So it is heavily, it can be an indicator of kidney function. So it's something that we monitor, but it can be, a lot of times it's just because of what's in their diet. But so the nitrogenous wastes and the urea, one thing I want to mention, and I like to always give you guys like clinical tips. When an animal was going into renal failure, a couple signs that owners notice is vomiting and not eating. Now, when they have elevated BUN, the urea nitrogen makes them feel very nauseous. And sometimes they'll even drool, because now I've seen cats, and I feel bad for these cats, like they go up to their food because they're hungry. But when they start to smell their food, if you've ever been sick and then you smell food, you think you're hungry and then all of a sudden you get nauseous. Well, a lot of times in cats, when they have this elevated BUN, they may kind of want to eat, but the smell of their food, or they just, it just makes them nauseous. So that, a lot of times cats, one of the presenting signs is my cat won't eat and they're vomiting. And Now, there's lots of reasons for that. I'm not saying there's 100 reasons probably, but that's can be an indicator because that level makes them feel ill. The other thing, bile salts and pigments. So the bile salts and the pigment, remember, a lot of bile salts go back through the portal vein and get reabsorbed by the liver, but anything that makes it into circulation from the intestine, some of that blood flow does go to the kidney. So if there's any bile salts that don't get reabsorbed in the liver, they're going to go to the kidney and they're going to be excreted. Also, bilirubin. So if an animal has, remember I told you, an animal has elevated bilirubin in the blood, we also have to monitor bilirubin in the urine, because if there's excess and the liver can only process so much, it's going to get excreted in the urine, and sometimes we'll pick up an elevated bilirubin in the urine and the blood. Excuse me, I'm sorry. Sorry, my son calling. Okay, and then the other thing, there's various salts. So let me, on the next slide here, it's what are the common things that the body gets rid of and what are common routes. So the respiratory system primarily is how we get rid of carbon dioxide. Also, some body water through water vapor is going to be, excreted when we exhale. Now, the sweat glands are primarily body water and salt. Some urea is excreted in the sweat. And then our digestive system is going to help process bile salts and pigments, but then the urinary system kind of does everything. Urea, salts, water, and anything that's a soluble waste. Let me explain what a soluble waste. If something is soluble, it's dissolvable. So sometimes when wastes make into the blood and they're soluble, it means that they can pass from the blood into the kidneys and then they can be processed. So pretty much the kidney, I kind of joked around, I call the body, or I call the kidney, I call the liver the body's Brita filter. The kidney's kind of like that too. So all the blood from the intestine goes to the liver, is processed. That blood is also going to go to the kidney, and then the kidney is going to excrete the wastes as part of the urine. Okay, so this is the single most important route for the majority of wastes. Now, I've already, like I impressed upon the liver processes food and wastes, or nutrients, I should say, from the intestine. But if we're talking about excretion of waste, the kidney is our number one way. Anything that's going to be soluble, meaning it can pass from the blood into the kidney, it's dissolvable. When something isn't soluble, like when I talk about proteins in the blood, and they're very large, proteins usually are a large enough molecule and they remain intact within the blood. They don't normally filter into the urine. Some wastes and nutrients are large and remain in the blood. But if something's soluble, it's typically, I think about solubility and dissolvability, or can it pass from the blood into the urine? And then this is really important. Excess water, the body needs the urinary system to get rid of that. Again, you don't want to be overhydrated. I know everybody focuses on dehydration, but you don't want to be overhydrated. So the body is going to maintain that balance. I'm going to talk about what happens if the animal is dehydrated, the kidneys have a role. And if there's overhydration, the kidneys have a role. So organ-wise, it's pretty self-explanatory. You have two kidneys. The right kidney is slightly more cranial, so it's a little bit more forward than the left kidney. You have two ureters. Now, the ureter is the tube that takes the urine from the kidney to the bladder. So it's only the ureter's only job is to get away from urine to get from the kidney to the bladder. There is one, so two kidneys, two ureters, one bladder, And then the urethra is the tube that leaves the bladder that connects to either the prepuce or either the penis or the vulva. A lot of people get urethra and ureters confused. Okay, so there's two ureters that come from the kidneys. The urethra is one tube that takes the urine from the bladder out of the body. But you're not on the outside when you look at a female and you see a vulva, and on a male you see a prepuce, which is covering the penis. That is where the urethra connects to. So you're not going to see the urethra like when you look at the outside. That's the urethra is going to connect to either the vulva or the penis, and then urine leaves. As every section I teach, there's jobs for these organs, and I've already told you that it produces urine to, get rid of wastes. The wastes get put into the urine leaves the body. So that's the number one job. But it also is the kidneys. I cannot tell you how are important for overall body homeostasis. The body is going to recruit the kidneys for a lot of other functions. Number one, blood filtration. So I've talked about the liver, but the kidney is going to filter. Now, when things go to the kidney, I should make this disclaimer. When it goes to the kidney, and I'm going to talk about this more in depth later, stuff is going to get pushed out of the blood into the kidneys for processing. Sometimes nutrients or things the body wants get pushed out, and those will get reabsorbed in the bloodstream near the kidney. And some things get pushed out and they're going to be secreted, which means secreted into the urine. So at the kidney, the body can reabsorb things it wants back, like calcium and sodium and potassium, and it's going to excrete things like salts and water and nitrogen and urea. So at the kidney level, the body can still reabsorb things if it needs it, but if it gets secreted, it becomes urine, which is mostly your wastes. Fluid balance regulation happens at the kidney. Now, the kidneys are under the influence of a hormone called ADH. And ADH, you need to know, stands for antidiuretic hormone. I'm not going to talk about aldosterone as much. I want to focus on ADH. Now, we're going to do hormones next, which is the endocrine system. But for right now, ADH, which is produced in the pituitary gland, is going to help maintain water balance, fluid balance regulation. And I'll get into that. Acid-base regulation. So maintaining blood pH and that acid-base balance is key for cellular function. Remember, we want the blood to be typically base, and anytime we get into like an acidosis or an alkalosis, the kidneys are going to have a role in maintaining. This is hugely important. I'm going to talk about production of hormones, primarily erythropoietin. I joke, and sometimes you can ask older students if they say, what's Landeris's favorite hormone? My favorite hormone to talk about is erythropoietin and the connection to red cell production. So I'm going to go in depth about that. And then maintaining blood pressure. So the kidneys do have a role. Obviously, the heart and the blood vessels, that's where we measure blood pressure, and the heart and the blood vessels and the relationship there maintains normal blood pressure. But if there's an abnormal blood pressure, the body will recruit the kidneys to potentially help improve blood pressure. So I will talk about that. You have to understand where the kidneys are in relationship, and let me see if I can pull up this picture here. Hold on a second. Because I think it'll be easier to look at a picture. The wonders of the internet. Okay, so I'm going to look at a couple different pictures here. Hopefully you guys can see this. So normally right here would be the diaphragm and the last rib. So they are very dorsal in the abdominal cavity. They are actually adhered up against the vertebrae. So they live and they are up in what's called the retroperitoneal space. So if you remember, the peritoneum is the lining of the abdomen. The kidneys are underneath that lining and they're covered with a layer of fat. A lot of times during dissection, I said, hey, you know, someone comes over and they go, my cat doesn't have kidneys. I'm like, well, you wouldn't be dissecting an adult cat if it didn't have kidneys. So they're here. You got to kind of move everything out of the abdomen. They're not just, sorry, hair in my mouth. They're not just floating in the abdomen. They're up against, and they're in the retroperitoneal space. So you have to do a fair amount of dissection. They are just caudal to the last rib. So when, if you guys remember when I talked about IM injections, remember I said I talked about the lumbar? Well, here's the lumbar muscles if you're looking at me pointing. I told you if you went cranially and you got under that rib, you could technically go intra-kidney. So you always want to find your last rib and go behind it. And that's because that's where the kidneys are. You don't want to go really close to that last rib. Here's, let's see, maybe I can get a better. Okay, here's a little bit better picture. So here's the liver, the stomach, here's where the kidneys are, and here's in relationship, here's the gut. Go. Sorry, they're like WrestleMania. So here's also a good example. So the kidneys, now in this picture right here, all of these stomach, liver, intestines is being removed. So normally you're not going to open the abdomen and be like, there's the kidneys. This has all been taken out. And you can see the right one's a little more cranial than the left. You can see the aorta branching to the kidney, and look, here's the renal vein that's going back to the vena cava. So this is good for blood flow. But this is where the kidneys live in the abdomen. And then there's some pictures here of the anatomy of the kidney. Sorry, okay, I'll probably come back to that in a second. Okay, so I do want you to be able, on a test, if I ask you describe where you find the kidneys, I want you to be able to explain it using these terms. Because some people just say, oh, they're in the cranial abdomen. There's a lot of space in the cranial abdomen. So they're ventral to the first few lumbar vertebrae on either side, and they're retroperitoneal, meaning retro is kind of like backwards or underneath. They're under the peritoneum and they have a large amount of fat. Now, if you describe gross anatomy is what you can see with the naked eye. And if you like chili and you talk about kidney beans, they kind of have that oval shape, but they do have a little bit of an indentation. Kind of a brownish maroon color when we see them. They do have a capsule. There's a kidney capsule. So, and it's very fibrous. Like when you go to dissect these out, you have to kind of like cut that. You can't just really tear it with your fingers. It's pretty dense. You know, the kidneys are anchored and protected. So it's not like they're, like I said, they're not just floating. They're anchored up against the lumbar vertebrae, just ventral to the first couple vertebrae, and caudal to the last rib. On this medial aspect, this is where you've got the artery, the vein, and the ureter enter, and that's called the hilus. Remember, a hilus or a hilum is where, you know, the hilum in the lung is where all the blood vessels and the bronchi and everything connects, kind of in the center of the lungs. Now, inside there's like a pelvis, which we're going to look at here. So now, normally during dissection, we will go ahead and also, first I want you to look at them in the body. Then you can cut out a kidney and cut it in half. And then you can look. The outer part think about cortex or C. The cortex is this outer core here, which is kind of a smoother structure. And then the medulla are these little kind of funnel type structures. So the cortex is on the outside, then you have the medulla, then a calyce are these little yellow tubes here, because when the kidney makes urine, it's made within the cortex and the medulla. The urine then funnels into these calyces, and all these calyces enter what's called the renal pelvis, which is like a V. So all the urine is being funneled from the calyces, and it's made in the cortex and the medulla. The urine goes through the calyce and it goes into the pelvis, which connects to the ureter. And then that ureter goes to the bladder. Now, all of this can be seen grossly. I mean, you can cut it in half and you can look at this structure. There are just a few, most kidneys look the same. I want you to know this top kidney is from a cow. So a cow, now they have the same parts as a dog kidney, but it's called a lobular kidney, meaning it looks like it has these lobes. Now, you still have a cortex and a medulla and a calyce, and then these tubes, the pelvis just looks like a series of tubes. This is a normal kidney. Now, if you opened up your cat during dissection and I saw this, that's highly abnormal. A dog and a cat kidney look, you know, fairly the same, and it should be smooth and not have this bumpy lobular appearance, but this would be normal for a cow. So again, same parts, still has a hilus, artery and a vein, cortex, medulla, calyce, pelvis, ureter, just a different design. And then this bottom figure is the dog and the cat. So instead of having this separated medulla, you've got this medulla, and then it connects to a pelvis and a ureter. So this is what's called the gross kidney anatomy. Now, microscopically, we have to think about what a nephron is. And what you need to know about the nephron, it is the functional unit of the kidney. This is what is making urine, okay? And I want to say, I found a handout that said like a cat kidney or a dog could have up to 200,000 nephrons, okay? So this is showing you one. This is what one nephron looks like. Again, this is making urine times 200,000 of them. Hold on 1 second. Okay, so this is this is the functional unit of the kidney. And again, you know, a kidney is going to have hundreds of thousands of these. So each one of those is making urine. This is the picture that you will need to know for this test. So we're going to spend a fair amount of time talking about this. You know, now different species have different numbers of nephrons, but I want you to know the nephron is the functional unit of the kidney that makes urine. The parts, the main parts are, we have what's called, if you look over here, there's a bracket called the renal corpuscle. So the renal corpuscle contains the Bowman's capsule, which is this brown thing right here. And then it contains something called the glomerulus, which it looks like these little, which they're little tufts of capillaries. This whole thing reminds me, I don't know if you've ever been outside and there's like this one weed and it has like a weird, it looks like a big seed pod, and if you open it, a bunch of those fuzzy things come out. That's what this kind of reminds me of. It's kind of like, so this structure, this whole thing is the corpuscle, and the corpuscle is this Bowman's capsule, this capsule, which surrounds the glomerulus, which is like the capillaries that are the filter. And then there is this space around it. There's a gap here. And this is called the capsular space, okay? Now, if you notice blood flow, Here is red blood coming in. So what happens is when blood comes from the aorta, remember it comes to the renal artery, it's going to branch, that artery is going to branch into tiny little arterioles, and they are going to go to every single nephron. So if a cat has 200,000 nephrons, there's effectively 200,000 arterioles. Now, so what happens is when blood comes to the kidney, it's first going to enter this thing right here, which is called the glomerulus. And then when the blood gets pushed in there, and anything that's soluble, remember dissolvable, is going to get pushed out into this capsule. And that's what I'm going to talk about. That's how urine is beginning to be made. After it enters this, it enters the Bowman's capsule, whatever gets filtered is going to enter this yellow tube. Now, these yellow tubes are not blood supply. These are the tubules of the kidney, okay? So this first one is called the PCT, which is the proximal convoluted tubule. So whatever gets filtered out of the blood, which is some body water, nutrients and wastes and electrolytes, is going to go into this PCT, and it's going to go and it kind of swirls and twists, and then it comes down to here, which is called the loop of Henle. Now, if you look over here to the right, you see two brackets. It says renal cortex and renal medulla. Half of this structure is in the cortex, and half of this structure dips into the medulla. The loop of Henle dips down into the medulla. The Bowman's capsule is in the cortex. Okay, so I want you to kind of understand where I'm talking about. So a nephron, which is kind of long, and then in this whole thing, in this whole cortex would be 200,000 of these things. So that's kind of where I'm at. Okay, so after filtrate, what gets pushed out of the blood moves into the PCT. It's going to dip down into the loop of Henle, which is in the medulla. And then it's going to come back up to what's called the DCT, which is the distal convoluted tubule. As it moves through there, it's then going to enter what's called the collecting duct. Now, once the filtrate moves into the collecting duct, it has now become urine, because once it goes in the collecting duct, it's going to go down through that calyce to the pelvis, to the ureter, and become urine. Okay, so this is the beginning. What I'm going to be talking about in this picture is the beginning of urine production. Okay, so it moves down here, and once it goes the collecting duct, then it leaves. But what you also notice in this picture, look at all these tiny blue and red squiggles. The name is not over here. Those are the peritubular capillaries. Because remember, the capillaries are that's where oxygen is exchanged with the nephron. Carbon dioxide is picked up, because remember, these capillaries are going to go back into this renal venule, which is going to go into the renal vein, which is going to go back to the vena cava. Now, at these capillaries right here, this is where, remember I said sometimes things will get pushed out here by accident, sometimes like sodium or potassium, and the body's like, I want that back. Well, as that sodium or potassium moves through the tubules here, those capillaries can reabsorb that, and then that goes back in the bloodstream. So I'm going to spend a lot of time talking about what's happening. This is where urine is made. This is the functional part of the kidney. This is where urine is made. And for today, I want to stop there, because I think we've talked about enough, and this is where I'm going to pick up, because this is the beginning of understanding how urine is made, what is filtered, what is reabsorbed. How does the body maintain water balance? Does anybody have any questions based on that?